Good morning, everyone. Thank you for joining us bright and early today for our Wake Up with Research breakfast. I'm Daryl DeWald, Vice President of Health Sciences for WSU, and I'm the Chancellor for the WSU Health Sciences Spokane campus. We are extremely excited to be back with you this month, and we hope things are going well for all of you as we gear up for spring. Things are bustling on our campus and across our system. Our students prepare for finals and commencement. And remember, this is only 6 weeks away. For those who have not joined us before, we started this research series nearly 2 years ago. We launched the series virtually due to the pandemic. And initially, we were pleasantly surprised at the number of people joining us virtually. But we also learned through feedback that many of you like the early morning virtual format. And because of that, we've decided to keep it this way, at least for the time being. We're still figuring out what our fall series will look like. As we know, being together in person is a great thing. We will certainly let all of you know what our new research series will entail. So, how did Wake Up with Research come about? Our goal was to provide a backdrop for the community to learn more about the research that's happening not only in Spokane, but across our system. It's really cool today. You're going to hear from folks across our system. Our researchers are doing some amazing things and making important contributions in so many fields, of which you will hear about today. Studies of research range from sleep and performance, to addictions, to cancer, to chronic disease, and yes, COVID-19. The list is extensive. Our researchers are discovering and working through complex and life-changing problems, which ultimately their work will enrich the quality of life for all of us. And that's a wonderful thing. I now want to acknowledge an organization that is also doing its best to improve the quality of life for those in our community. And that is our sponsor for today's Wake Up with Research, MultiCare. Joining us this morning on behalf of MultiCare is Jennifer Graham, Chief Nurse Executive with MultiCare Health System. Jennifer.
Thank you, Daryl. I appreciate the introduction. MultiCare is proud to sponsor this series and excited to hear more about the topics of research today. MultiCare is a longstanding proud sponsor of Wake Up to Research Breakfast. Sponsorship of this forum is a direct extension of our mission, which is partnering for healing and a healthy future. Research and other scientific endeavors really are just a mechanism to imagine a new future. Sharing research widely like this can give all of us the inspiration to collaborate and a vision for how we can improve the health of our communities and hope for a better future for people in our region, our state, and really worldwide. Thank you.
So thank you, Jennifer. We really do want to thank you again for your partnership with WSU and your continued support in this community, but across the state. I'm now going to turn things over to Dr. Celestina Barbosa-Leiker. Celestina is the Vice Chancellor for Research at WSU Health Sciences Spokane and a full professor in the College of Nursing. Celestina is an outstanding researcher in her own part. She's an elected member of the Washington State Academy of Sciences, and she does high impact research. So it's fitting that Celestina is the lead for our Wake Up with Research. Celestina.
Thanks so much, Daryl, and thank you all for joining us again today with this Wake Up with the Research. I want to begin with a land grant acknowledgement. Washington State University acknowledges that its locations statewide are on the homelands of Native peoples who have lived in this region from time immemorial. The university expresses its deepest respect for and gratitude towards these original and current caretakers of the region. As an academic community, we acknowledge our responsibility to establish and maintain relationships with these tribes and Native peoples in support of tribal sovereignty and the inclusion of their voices in teaching, research, and programming. As Daryl mentioned earlier, it's my hope that you'll leave us today really understanding the research that's being done not only here at Washington State University Health Sciences Spokane, but across the entire state of Washington. We are really excited to be able to share with your presenters that are across all of our physical campuses here at WSU doing fantastic research, and we have so many colleges represented this morning as well. Before I get to our speakers though, I'd like to touch on what got us here today, and that is that Washington State University is a land-grant university. And here at Washington State University Health Sciences Spokane, we manifest that commitment to our land-grant mission by working to better serve the health and well-being of every resident in the state of Washington, not only by our education of nurses, pharmacists, physicians, and other healthcare professionals for our future workforce here coming out of WSU, but also through fantastic research that has high impact that is working towards improving the health and wellness of every resident in the state of Washington. WSU has 5 campuses, physical campuses, across the state of Washington. And so we have a great map for you that highlights exactly where these 5 campuses are located here at WSU. While WSU Health Sciences Spokane is named the Health Sciences Campus, health sciences research just isn't done here in Spokane. It's done across all of our campuses. Health sciences is really a system-wide approach to how we can best serve every resident in the state of Washington. And so we have speakers from Everett, Vancouver, Tri-Cities, and Pullman joining us here virtually, while most of us are here in Spokane. Our research really is done not just across the state of Washington, but the Pacific Northwest, the entire nation, and as you'll hear, internationally as well. Our next slide shows you just a small snapshot of all of our clinical partnerships across our health sciences colleges here in the state of Washington. You are able to see our wide reach. These are just some of our clinical partners across the College of Nursing, the Elson S. Floyd College of Medicine, and the College of Pharmacy and Pharmaceutical Sciences. You can see that really health sciences is across our state and across our WSU system. Thank you very much for showing those slides. Now, I want to introduce our panelists from across the state of Washington, of course, representing our great WSU physical location campuses here. We're going to start with Dr. Angela Stewart, who is the Associate Dean for Rural Health and a Professor of Pharmacotherapy in the College of Pharmacy and Pharmaceutical Sciences in Yakima, Washington. Next, we'll have Dr. Sarah Tregesser, Associate Professor in the Department of Psychology, College of Arts and Sciences at WSU Tri-Cities. We'll then have Dr. Guy Palmer, a Regents Professor of Pathology and Infectious Diseases, a Jan and Jack Creighton Endowed Chair in Global Health from the Paul G. Allen School for Global Health from WSU Pullman. We'll then have Dr. Shelley Fritz, Associate Professor in the College of Nursing from WSU Vancouver. And then finally, Ellie Avery, Scientific Operations Manager from Nutrition and Exercise Physiology from the Elson S. Floyd College of Medicine from WSU Everett. I want to thank you all for joining us this morning. And before I begin, though, I want to remind all of the viewers out here that are joining us again this morning that you can submit any questions that you may have for our presenters at any time during the presentations. We'll have every presenter go ahead and share about their research going on there on their campus and the statewide and region and global reach of their research. And then we'll begin a Q&A. So we'll go ahead on our end and track all of your questions. So again, feel free to put your questions in the chat there, and we'll get them answered here live at the end of the presentations. Lastly, I want to invite you all to join us later this morning and throughout the day for our Inland Northwest Research Symposium. That's also going on today. There are more than 70 participants who submitted research abstracts, and 58 of them will be presenting today live over Zoom. You can find that presentation schedule starting at 9 a.m. and going to 4 p.m. And the Zoom link on our website at spokane.wcu.edu and then search for Inland Northwest Research Symposium. And Denise will go ahead and add that link to our chat in YouTube. So let's get right in. We're going to begin with Allie Avery, Scientific Operations Manager, Nutrition and Exercise Physiology from the Elson S. Floyd College of Medicine, WSU Everett. And Allie's going to speak on some of her research around COVID-19. Allie.
Thank you, Celestina. It's a pleasure to be here today. My name is Allie Avery, and I manage the Washington State Twin Registry, which is a database of twins primarily residing across the state of Washington who have indicated an interest in participating in research studies. To give a very brief history, up until 2019, the Department of Licensing asked about twin status to avoid issuing duplicate license numbers, which were based on one's date of birth, last name, and initials. Since this had the potential to generate the same ID numbers for twins, individuals were asked about twin status to ensure a different number was generated for the second twin. License numbers are generated randomly now, but the DOL still asks about twin status for identity theft reasons. We have a data sharing agreement with the Department of Licensing, which allows us to receive the names of individuals who indicate twin status on a weekly basis. We work with the WSU SESRC in Pullman to send out invitations as funds allow. We also allow volunteers who are interested in joining, but not identified by the DOL, to enroll. So since 2002, we have enrolled over 9,000 adult pairs and over 500 youth pairs. So why are twins important? They are important in research for understanding how genes, behaviors, and environment affect health outcomes and general well-being. Identical twins share nearly 100% of their DNA, while fraternal twins only share about half their DNA on average. So if a particular health outcome is associated with something in the unique environment, we would expect to see this association when comparing twins to other twin pairs and when comparing one member of a twin pair with their co-twin. However, if the association goes away when comparing one twin with their co-twin, the association is likely due to something shared within that twin pair, such as genetics or shared household, which the twins were raised. So as we all know, Washington State went into a lockdown on March 23rd, 2020. A few weeks prior to that, our research team noted that things seemed to be getting worse, so we started working on a survey that could be sent electronically to participants in the registry. Our survey was quickly approved and sent out on March 26th, which was just 3 days after the lockdown began. We sent the survey to all twins who were actively enrolled in the registry and had an email address. We received nearly 4,000 responses to that baseline survey, and we've used data from that survey to examine changes in mental health as a result of the lockdown. So I'll talk about our physical activity papers. We've published 2 papers looking at mental health and changes in physical activity. So on this baseline survey, twins were asked about perceived change in physical activity. So either exercising more, exercising less, or exercising the same amount compared to prior to the lockdown. We found that more people reported a decrease in physical activity compared to an increase in those first few weeks after the lockdowns began. A perceived decrease was associated with high levels of stress and anxiety. Within identical twin pairs where one twin experienced a perceived increase in activity and the other experienced no change, there was little difference in levels of stress. When looking at anxiety, the twin with a decrease in physical activity had a higher level of anxiety than their twin who had no change. However, when we controlled for age and sex, this difference was no longer significant. We had a follow-up paper which used data that we collected in April, July, and September of 2020. That one found that changes in physical activity were not associated with changes in stress or anxiety over time. Next, we examined changes in stress and anxiety with changes in alcohol use. So on this baseline survey, again, twins were asked about perceived changes in alcohol use. So either drinking more, drinking less, or drinking the same amount compared to before the lockdown. We found an association between stress and change in alcohol use. And in twin pairs where one twin reported similar alcohol use while the other twin reported an increase, stress levels were significantly higher in the twin with increased alcohol use after controlling for shared genetics and environment, age, and sex. We found a similar result in twin pairs where one reported a decrease in alcohol use and the other reported no change. We found that an increase in anxiety was associated with both increased and decreased alcohol use when comparing twin pairs to other twin pairs, but it was not significant within a pair of twins. So these findings offer evidence that the lockdown did influence alcohol use, which had an influence on stress and anxiety. We have looked at changes in stress and anxiety associated with sleep behaviors. So twins were asked about perceived changes in sleep length and sleep quality. So again, either an increase, a decrease, or no change. We found associations between both decreased sleep amount and decreased sleep quality with stress and anxiety. So again, the twin who experienced a decrease in sleep amount or a decrease in sleep quality had higher levels of stress and anxiety than their twin who experienced no change. So these findings offer evidence that there is a association between decreases in sleep quality and sleep length and levels of stress and anxiety after the lockdown that is caused by that lockdown. Or at least could be caused by the lockdown. We found an increase in both stress and anxiety was associated with an increase in sleep length and sleep quality when comparing twin pairs to other twin pairs. However, when comparing twins to their co-twins, it was not significant. And then finally, we examined changes in mental health in women with children and without children in the household. So in May 2020, we sent out a baseline questionnaire to parents of twins enrolled in the registry. We used this data in addition to the baseline survey data from the adult twins. And in the first part of this study, we assessed whether women living in households with children under the age of 18 had higher levels of stress and anxiety than those without children in the household. We found stress levels did not differ, but anxiety levels were higher among women living with children compared to those living without children. And in the second part of the study, twin pairs with children and without children in the household were compared. We found the presence of children in the household was associated with higher levels of stress and anxiety, but this association went away when controlling for those shared genetics and environment. So because we sent the survey out so soon after the lockdown started, we were better able to understand the impact that those COVID lockdowns had on health behaviors such as physical activity and drinking, and health outcomes such as anxiety and stress. We have collected 7 follow-up surveys since April 2020. Our 7th follow-up survey is currently in the field with data collection ending today. So in this latest wave of the survey, we added questions about long COVID, which is becoming a prevalent public health issue. By examining differences within the twin pairs, we hope that we might be able to understand why some people have been so negatively impacted by COVID while others have not. And that is the end of my slides.
Great. Thank you so much, Ellie. What a fantastic job. Really a great overview of all of the different things that your group, your research group across the state of Washington has been able to link with COVID-19. You hit upon psychological issues, alcohol use, physical activity, sleep, parenting. You've hit so many different research areas with just that quick presentation. Thank you so much for joining us this morning.
Okay, thank you.
Our next presenter is Dr. Shelley Fritz, Associate Professor in the College of Nursing from WCU Vancouver, and she's going to be speaking about her research about health technology tools. Shelley.
Good morning, and thank you, Celestina, for the invitation to be here today. And I'm trying to forward the slide. Hold on. Okay, so my ideas for research come out of more than 30 years of nursing, mostly in public health, the emergency room, and hospital administration. My goal is to innovate health technology tools that enable persons with chronic conditions to better manage their symptoms so they can reach their life goals and so they are less likely to end up in the emergency room. To do this, I collaborate with engineering and psychology researchers in Pullman, Drs. Diane Cook and Maureen Schmitter-Edgecombe, and with multiple community partners like Touchmark right there in Spokane. One health monitoring tool that we are developing is a smart home. The smart home uses motion sensors and artificial intelligence to track an individual's daily routines at home and report objective information about those routine changes that might be clinically relevant. So as nurses, we know that when people don't feel well, they move differently. And we all know that most of life and illness happens in the time between visits with our healthcare providers. So our smart home is designed to help with real-time recognition of health changes occurring at home. so nurses and docs can intervene closer to when the change happens, and we can tailor our care more precisely. The picture on the left shows the sensors we use. They are kind of like smoke detectors, or they look like smoke detectors in a way, and they're designed to be unobtrusive, to not draw attention, and we don't use any cameras or microphones. In fact, most of our research participants say they completely forget about the sensors, that they're there once we would install them within like 48 hours. And they remember that they're there when we call to check on their health. In the center, you see that we put sensors in various locations in the home. And as individuals move about their home, the sensors send us text messages, like the ones you see on the far right here on the slide. The sensors use the same technology as the light that automatically turns on your porch or in your garage when it senses motion. But instead of a light turning on, we have configured our sensors to send us a text message showing which sensor is currently sensing motion. A computer algorithm monitors this massive amount of data in real time and is being trained to alert us on when an individual is moving differently because they aren't feeling well. So far in our research, we found that we can detect and triage a variety of important health changes in older adults with chronic conditions. For example, we have recognized falls, side effects to medications and treatments, insomnia, cognitive changes, and important changes in persons with lung disease. As you can imagine, the information that we get from this type of monitoring is new to nurses and docs. So I also work with how to share this type of information with my healthcare colleagues so it is useful to them. We found that providers would use this information in care planning and prescribing if it were readily available. However, we also found that they don't want to manage this type of data. They would rather have it easily summarized and reported by their staff, similar to how vital signs are reported. We also found that older adults with varying backgrounds say they would use a smart home right now if it were available. My research helps patients, nurses, and docs more objectively understand the human response to illness, better understanding of how humans respond to their health conditions, and being able to triage symptoms in the home and provide precise and timely interventions, some of them automated, could help patients better manage their chronic health conditions, leading to better health outcomes. Thanks.
Thanks so much, Shelley. Thank you for that great presentation. You talked about everything from using sensors to identify changes in health to help improve health, and really the key to understanding and synthesizing data, all in a very quick presentation. Thank you so much, Shelley, for joining us this morning. I just want to remind everyone again, as you have questions for our presenters, just be sure to put them in the chat there, and we'll get to all of them at the end here. Turning to our next presenter, from WCU Tri-Cities, Dr. Sarah Tregesser, Associate Professor in the Department of Psychology in the College of Arts and Sciences. Sarah.
Thank you, Celestina. So good to be here. Thank you for inviting me. So let me just share my screen. Can everybody see that okay?
Yep, perfect.
So I'm Sarah Tregesser, Associate Professor of Psychology from the Tri-Cities campus, and I'm really excited to tell you about my research on a positive psychology approach to substance use disorders among individuals with personality disorder features. So I study personality disorder features from a dimensional perspective. And what this means is that we look at personality disorders just as extreme variations on normal personality traits that exist in the population. And this is useful both for understanding personality disorder symptoms, as well as for understanding normal personality traits and what they're related to in the population. The personality disorder characteristics that are especially important to substance use and to borderline personality disorder are affective instability and impulsivity. Affective instability means a tendency for emotions to be dysregulated, unstable, unpredictable, and usually in the form particularly of negative emotionality. The other characteristic that's really prominent is impulsivity, the tendency to act on impulses, to not think ahead, and especially impulses that are related to negative states like mood states or cravings. So in my research, what we've found is that people with these personality disorder features tend to drink and use substances for two main reasons or motives. One of these is to cope with negative emotions and cope with that negative affective instability. And the other is to enhance positive emotions. And these are the primary reasons for drinking. So one of the questions I'm asking in my research now is how can we focus on these reasons for drinking and replace the role that alcohol and other substances have for individuals with these personality traits or with these reasons for drinking. And I've turned to a positive psychology approach because typically I've found in the literature that personality disorder features and substance use is studied from more of a deficit model, from the perspective of just focusing on the deficits and focusing on the symptoms. And positive psychology can bring a larger perspective on understanding how strengths might be able to buffer these deficits, or how we can improve some of the strengths or add some quality of life for individuals, even who have emotional instability and impulsivity. So the literature in positive psychology contributes a couple of important things that could potentially impact and help us improve substance use problems for individuals who have these reasons for drinking or for these personality disorder features. One of these is mindfulness-based intervention strategies as a replacement for coping with negative emotions instead of using substances. And one of the tools that comes along, there's a number of tools in mindfulness-based strategies, but one of them in particular is, for example, the ability to decenter, or to be able to see an emotion, experience an emotion, but then get some perspective from it, a little bit of distance from it, and objectively look at that emotion instead of being carried away by this emotion and have it take over an individual and feel powerless over that emotion. In addition, in terms of how can we provide something that can enhance positive emotions instead of using substances, the concept of eudaimonia or eudemonic meaning is found in the positive psychology literature. And it basically contrasts two ways of seeking positive emotions or meaning in life. The hedonic approach to seeking positive emotions is the focus on immediate pleasures, short-term happiness, feeling good, such as using substances or overeating or sex, or immediate pleasures. So people with substance use disorders tend to be more focused on these hedonic approaches to seeking happiness. Another approach could be to help them learn to find more eudaimonic sources of happiness, which include longer lasting, deeper, and more sustainable sources of well-being. So the research on eudemonic meaning includes 6 different facets or 6 different areas where people can find meaning that's beyond just that feeling good in the immediate. One is in terms of personal growth, and this means finding goals that help develop one's potential and one's unique abilities and talents. The second is the idea of environmental mastery, and this is where people can gain happiness through finding ways to get the environment to meet their needs, suitable to their best self and the needs that they have. The third one is finding happiness and meaning through personal connections and positive personal relationships and helping others. The fourth is called autonomy, and what this refers to is feeling like one has choice in their activities. feeling like they have intrinsically motivated behaviors, like they're choosing their activities instead of feeling like everything they do is controlled either by another person or by the environment. The fifth is self-acceptance. And this is the ability to learn to accept the self, both for strengths as well as weaknesses. And then finally, finding activities and beliefs that give one a sense of purpose in life, a feeling of direction in one's life, a feeling of meaning in life. And these 6 areas conceptualize what's called eudaimonic meaning, which is that meaning that comes from larger, more sustainable goals and activities that can replace using substances. So in my research, we're moving toward finding out how a switch from hedonic meaning to eudaimonic meaning can help improve quality of life, reduce substance use and its consequences, especially when combined with those strategies for coping with negative emotions. Thank you so much.
Thanks so much, Sarah. That was so great. I really like the focus on positive psychology approach for personality disorders, moving away from that deficit-based modeling to the strength-based modeling of that. And thank you for sharing with us 6 areas for goals for everyone, really. Thank you so much, Sarah, for being here this morning. We'll now go to our 4th presenter, Dr. Guy Palmer from WSU Pullman. Dr. Palmer is a Regents Professor of Pathology and Infectious Diseases, a Jan and Jack Creighton Endowed Chair in Global Health from the Paul G. Ellen School of Global Health. Over to you, Guy.
All right. Good morning, everyone. Celestina, give me a thumbs up if you can see that.
Yep, it looks great.
Okay, perfect. Well, thank you. I'm going to talk a little bit. We're now more than 2 years into the COVID-19 pandemic. I think hopefully we're seeing the light at the end of the tunnel. But anytime I talk about COVID, I do want to always acknowledge the impact it's had on everyone, which really defines what a pandemic is. In the most tragic cases, obviously the loss of life, but it will also have long-term impacts on education, on economics, and in addition to the direct healthcare impacts of COVID infection. I think everyone's aware, as we've just heard, of some of the emotional, psychological impacts of COVID-19 in the pandemic, and also all of the delayed healthcare procedures and preventative and restorative that have been delayed or actually abrogated completely. So I always want to acknowledge the impact it's had on so many people, especially women who have had to take up increased childcare activities during the pandemic. It's a little bit like living on a 100-year floodplain. Doesn't mean you have 100 years until you have the next pandemic. So we really want to be better prepared for the next one than we were for this one. The good thing is that research knowledge is cumulative. And I'll just give one example of that. The genomic sequence of the virus that causes COVID was announced on January 8th of 2020, was first published. 12 days later, Michael Letko, who's a faculty member at Washington State University, actually had identified the way it enters cells and the protein that allowed it to do that. That was critically important because that paved the way not only for the vaccines, which have really been the best tool for preventing the most severe impacts of COVID-19, but also for the medicines we have now. And that was done in a mere 12 days. And that's how research knowledge is cumulative. We knew about SARS viruses in general because of the Hong Kong outbreak in 2003. We'd had 25 years of experience with mRNA vaccines, even down to the details of how you fine-tune the vaccine by incorporating what are called prolines, specific rigid structure amino acids that make the vaccines more effective. So knowledge is cumulative, and we'll do better just by that basis alone. But we also need to be better at implementing tools and having an early warning system. It took us far too long to get broadly impactful diagnostics out to where they were accessible to both the healthcare community, as well as what we're now seeing, where they're actually in the hands of the population. I do want to give a shout out before I get to my next slide, to Insight Diagnostics in Spokane. They were just a critical partner as we, together in a private-public partnership with the university in Pullman, developed diagnostics or implemented diagnostics to really meet a dearth of PCR tests early in the pandemic. And it ended up doing 100,000 tests throughout Eastern Washington and Northern Idaho. And Insight was just the kind of partner that just repeatedly said, how do we do it? Not that we can't do it. So I'm just very grateful for their collaboration throughout. So how do we do better next time? One of the critical things is to have early warning systems to give us the chance to get vaccines and things, medicines, diagnostics in place. One of the best examples of how this works is recently the ability of South Africa to identify and track the Omicron wave, which I've shown there in that upper right slide. It's the red line. The light gray lines are the previous waves of COVID variants. They saw this extremely steep increase in cases, followed by a fairly rapid decrease. That really was an early warning to the US that that's what was going to happen here, and it allowed us to respond. It allowed us to begin to look at how we manage our healthcare facilities to deal with any increased load on our hospitalizations, and especially on our ICUs. So that knowledge and that sharing of knowledge is critically important as we prepare for the future. So what's Washington State University doing about this? We really have three major programs that address this. The first of those is what's called a Center for Research in Emerging Infectious Diseases. This is based in East and Central Africa. There's 10 of these NIH centers spread across the US. I think fairly remarkably, 2 of them are in the state of Washington. One is at WSU and the other is at the University of Washington. So 20% of the total centers are based in our state, which I think reflects the commitment to global health within the state of Washington. It works in 4 countries in East and Central Africa, looking at emerging viruses and with this shared goal of then working across these centers to rapidly develop the vaccines and medicines necessary. I think we saw with Omicron the impact of capacity, both human capacity and laboratory capacity, to identify the Omicron variant in South Africa. Unfortunately, South Africa is a bit of an outlier in the African continent. They are much more sophisticated. They have much better trained personnel and laboratory facilities. So WSU is now leading a U.S. Agency for International Development program. You may have heard of this. It's a fairly large program. It's a $125 million program. The WSU leads. Our key partners are the University of Washington, Washington University in St. Louis, and the NGOs PATH, which is Seattle-based, and FHI 360, which is North Carolina-based. And in there, we're going to be working in up to 12 countries to strengthen the capacity on the laboratory side and the human capacity side so that more countries can behave as South Africa did with early detection and early warning for the rest of the globe to shorten that period of time between identification of an emerging virus and our ability to mitigate it as rapidly as possible. And the third that I'd like to highlight is in the bottom slide. This is a cohort of Kenyan physicians and veterinarians. They work in one integrated cohort with Washington State University and the University of Nairobi to develop the capacity to do the field sampling, to do the laboratory analysis, all the way into the clinic to deal with emerging, especially zoonotic infectious diseases. So I think our goals have been to increase capacity, to work very hard on coordination among different nations so that we can have that information, share it, and respond. And one of the critical elements that we will have to work on is the policies associated with information sharing. As some of you may have remembered, when Omicron was first detected in South Africa, the world's response to it was to shut down traffic from South Africa, which, as you can see, is a terrible disincentive for sharing information, and at the same time was totally useless. By the time someone detects a virus, a variant like that, it's already spread globally. So there are some policy impacts that also are required in addition to the increased laboratory and human capacity. I think that's my last point I'd like to make, Celestina, and I will turn it back to you.
Wow, Guy, thanks so much for that great presentation. I love what you said about knowledge is cumulative and the cumulative impact of science on vaccines and medicines. And thanks for the shout outs too to the other WSU faculty contributing to this and to Insight here in Spokane. So thank you. Our final presenter this morning is Dr. Angela Stewart, Associate Dean for Rural Health and a professor in pharmacotherapy in the College of Pharmacy and Pharmaceutical Sciences in Yakima. And she will be talking about building health in rural Washington. Over to you, Angela.
Thanks so much, Celestina. It's really, again, a pleasure to be here this morning with my panel of esteemed colleagues and with all of you from across the WSU system and across the state. And I'm really grateful for the opportunity to share with you all some details about the college's new rural health initiative. So why is the College of Pharmacy and Pharmaceutical Sciences refocusing its attention on rural health? We know that there are almost 3 million Washington residents living in health profession shortage areas across the state. And in Eastern Washington, all of our counties include health profession shortage areas in terms of primary care. And most of our Eastern Washington counties also have large medically underserved populations. Also, 6 Eastern Washington counties rank lowest in the state for health outcomes, including the very important outcomes such as lifespan and quality of life. So we know that there is this need for increased access to primary care, and this has only been highlighted and emphasized during the course of the global pandemic. Specific to pharmacy, we have learned during the pandemic that our rural residents really depend on their community pharmacies and community pharmacists for basic primary healthcare needs. And that includes the need for immunization and testing. And I've got a couple of the pictures on my slide here are of our students doing community outreach during the pandemic, partnering with our health district at some of the drive-through testing sites and administering immunizations. So despite these needs, we're also learning that many rural pharmacies are actually being forced to close their doors. And this is happening because of some adverse business conditions, as well as staffing shortages that may be exacerbated by the pandemic. And the result of this is the increase in the numbers of what we're calling pharmacy deserts. And a pharmacy desert is a location, a community where patients and others must drive significant distances in order to access pharmacy services. So what is our solution? It is our new rural health initiative. And the goal of this initiative is to directly and positively impact the health and wellness of our rural communities in Washington through a 3-pronged approach. The first part of our approach is to create new pathways for prospective students from rural communities to more readily enter the College of Pharmacy, as well as other health professions training programs. So again, to increase access to health professions education. Second prong is to develop an innovative curricular track within the Doctor of Pharmacy program to specifically prepare our graduates for providing pharmacy care to rural communities. And thirdly, we are hoping to embed, or we will embed, clinical faculty in pharmacies throughout rural Washington, with the goal of having those faculty members help to catalyze the implementation of innovative clinical pharmacy services, to increase the numbers of rural training sites for our student pharmacists, and finally, to develop postgraduate training opportunities for pharmacists who wish to further specialize in providing rural health care. And that third approach is indicated on the slide by those hub and spoke pictures there. We will be able to expand the reach of our current faculty and students on both of our campuses, our primary Spokane campus, as well as our Yakima Extension campus, and extend our reach out into those rural areas. In terms of research, we have tremendous early evidence about the potential impact of this rural health initiative. My colleagues, Drs. Kim McKiernan and Megan Underberg, are just now wrapping up a pilot study that they are conducting in Newport, Washington, where they are studying the outcomes of sending an interprofessional but pharmacy-led team into the homes of patients who have been identified as high risk for having complications from their medication therapy. And they've studied 28 patients so far. Of those patients, they're averaging over 14 chronic medications each, which is really incredible when you think about how to manage a list like that. And so this interprofessional team is identifying and correcting drug therapy problems that those patients are experiencing, as well as providing them with additional education and support to maximize their ability to adhere to their medication regimens. And early results show that they have been able to significantly decrease emergency department visits in the patients who have received this intensive and comprehensive medication review. So they're looking at about a 38% reduction in emergency department visits in the intervention group. So as our initiative is rolled out, we're confident that we will be able to expand these research efforts and more fully demonstrate the benefits and the impact of pharmacy care in rural areas. Thank you so much.
Thanks so much, Angela. What a great presentation. Thanks for highlighting the issue of pharmacy deserts, especially in rural areas. And it was great to hear all about this new initiative and program, and love that you're going to have these pathway programs for rural students. That's so fantastic. Thank you so much. Thank you to all of our presenters this morning. It's exciting to hear all of the ways that you're making an impact across the state of Washington. We heard from 5 presenters from 5 WSU locations from 5 colleges this morning. It's really exciting to see the reach that WSU has worldwide, really, building knowledge on a local, rural, and global scale. You've all done some truly remarkable things with your research and programming, and the work that you're doing on behalf of Washington State University makes us all very proud. So thank you. We now have time for our Q&A part of this Wake Up with Research. And Angie, I'm glad you're on the screen because I'm going to start with you. I have a question for you. A question came in about the rural health curriculum. So what can we expect that the rural track students will be learning?
Celestina, I'm having dog trouble. So maybe can you go to the next one and I'll be right back?
Absolutely. Absolutely. That is a great snapshot of just our life on Zoom, right? Absolutely. Ellie, let's have you pop on here. I do have a question for you. You did an excellent presentation this morning about the different studies that are related to COVID-19 with the twin study. What about other studies that have come out of the twin registry? I know your reach is across the state. Dr. Glenn Duncan here in Spokane. What are some of the other twin studies going on?
Yeah, so in the last year, we just finished a study that was looking at personal air pollution. So the twins carried a GPS and an accelerometer, as well as a monitor that was built by our colleagues at the University of Washington that measures pollution on an individual level. So the hope is that we can see how those, it collected information about, exposure to toxins and air pollution. So the hope is that we might see, if those exposures have an impact on health by examining, similarities and differences in the identical twins. We just finished a few months ago data collection on a survey regarding drug use with Crystal Laderhouse-Smith and Sterling Pearson, which they're currently analyzing the data for, just to see, drug use, marijuana use, drinking, what the genetic similarities are with the twins. We are currently collecting data that is looking at, so on some people's phones, you have Google Timeline, which collects data about where you go from place to place. And for some people, that goes back as far as 2012. So we are following up with the twins to see if they have that data that they would be willing to share with us. And we plan to, currently we're planning to link it with the COVID data that we collected with the baseline to see if, patterns in travel and daily habits changed as a result of the lockdowns. And then, we're always looking for new collaborations with investigators. So, if anybody is watching this that has interest in working with the Twin Registry, just feel free to reach out.
Great. Thank you so much. I'm sure you're going to get some researchers hitting you up on that. Twin studies are absolutely fascinating. Thank you, Allie. Guy, I have a question for you. So when we traditionally think about global health, we tend to think of a university kind of going into maybe a more underdeveloped country with this kind of helping framework here. How has that changed? And how is WCU's approach specifically addressing this with global health?
Yeah, I think that's been a major change in terms of how we look at strengthening capacity and really truly being partners. And that helps that information flow as well. The traditional model is lower income countries, especially African countries with which I've worked with quite a bit, would send a very few number of individuals to study in US, UK, or European universities. Then after a period of time, they would return back, but not really learning how to do the research and the disease surveillance and the disease response within their own context. And also that abrogated the ability of kind of peer-to-peer learning, because they were taken out of that environment where they could work peer-to-peer. So we've worked very closely with the University of Nairobi as an example, really just as partners in doing this. We share faculty, we share students, but it's a very different model that they continue to do their work within their own countries. And we provide expertise, but we also learn from them. I think that's one of the key areas in terms of information flow and knowledge gathering, is that we don't have all the answers. We learn very well what works in remote communities that I think we can apply to some of our underserved rural communities across the United States and here in Washington.
Great. Thanks so much, Guy. Shelley, I have a couple of questions for you. I'm going to bundle them all together. So one is on if the life alert is like a sensor, if that can be used in the same. Another question that just came in is kind of where can a person maybe that doesn't have access to research articles go to find some information like this? And then the third is about privacy in the home with sensors and things like that, and if that's something that you've encountered in your research.
Yeah, thank you. Those are great questions. So with the life alert, I really appreciate that question. I saw that it came in from the audience, and using the environmental sensing in the home was really key for me in my direction of research, because I cannot tell you how many patients come in to see me in the ER, brought in by ambulance oftentimes, and they are still wearing the life alert button around their neck and it's never been pushed. And there's good reasons for that, right? So sometimes their blood sugar is so low that the mentation doesn't allow them to think through that they have a button that they can push. I remember one patient who came in and when she fell, it had slung under her armpit and captured, and she had broken her clavicle and her hip and could not move to be able to reach it, and was down for many hours. So for me, it was really key to figure out a way that we could alert in real time or near real time without having to have the patient do anything to interact. And so I think the ambient sensing or environmental sensing really helps with that. So regarding where to go on the internet, maybe to find more information about this, there's actually several great articles with great citations that are on AARP's website. So if you're an older adult, that might be a place to start. Also, the Department of Health and Human Services has a National Health Technology Forum online, and you can go in there and see some of the technologies that they're looking into, that they're funding, et cetera. And an unexpected place to find a list of like all technologies and sort of places that you could go as adults with chronic conditions or older adults is the National Library of Medicine. They actually have a great website. If you just search health technology and remote monitoring, you'll find that information. And finally, I appreciate the question about privacy, because this was key to me also moving into this line of research, because when I came to WCU, I'm actually Coug alumni from the PhD program. Celestina was one of my professors. I had to have the question answered, would older adults even want to be monitored in this way? Because if my patients don't want to use the technology, you can create all the cool stuff you want, but it's not going to impact healthcare or provide better outcomes for people. And so my dissertation actually answered, sort of asked that question, would they want to be monitored? And the idea of privacy came up as a core theme in my studies. And what I found in a nutshell was that older adults do say they think that this will impact their privacy, but they helped me have an aha moment, which was they believe that if they move to the next level of care, if they can't remain at home, their privacy is also going to be impacted. And so they would rather trade a perceived loss of privacy for being able to remain home longer. And we do things to really help them remain private, which is all of the data encryption and securing all of that. And then just making sure that the people who have access to the data are the ones who really need it, similar to how we defined managing PHI or personal health information under the HIPAA laws in the United States as healthcare providers.
Great. Thank you so much, Shelley. We have just about 1 more minute left. I know some of our presenters are going to have to drop off here as they have other things on their schedule today. I wanted to go back to Angie, if your dog was settled, if you wanted to answer really quickly about the curriculum. And then I just have a quick question for Sarah.
Yeah, and again, apologies for that. We're very excited about the curriculum. So we are developing a new rural health course for pharmacy students. At some point, it would be wonderful if we can make that interprofessional. The course we're really excited about is a longitudinal capstone course where students in our rural track will be paired with community mentors as well as a faculty mentor, and will complete a mentored longitudinal project, which again is going to contribute to the research and scholarship of the College of Pharmacy and Pharmaceutical Sciences, but also, extend that knowledge out into those communities and help those pharmacies develop and prove those innovative services we've talked about. And finally, what we're really excited about too is partnering with the College of Nursing, the College of Medicine, and others throughout the WSU system for access to existing courses that are relevant to rural health and public health. So we have lots of new partnerships that we're developing as well.
Great, thank you. And Sarah, just finally, really quickly here, if you're still with us, just a quick question about mindfulness. Oh, sorry, it's all right. Everyone has very busy mornings. Mindfulness, you talked about mindfulness for folks with personality disorders. Is there any benefit for mindfulness for others, maybe to deal with burnout, things like that?
Absolutely. The research on mindfulness spans so many different conditions. It's incredible. From depression to chronic pain and other health conditions to just quality of life in general. So I think it's something that can benefit everybody. And that's one of the exciting things about my research, is that it's a topic that I think applies to a wide ranging populations and also just to the general population.
Excellent. Great. Thanks so much, Sarah. Well, thank you all to all of our presenters. We are out of time. And so we're going to wrap up here. And we want to thank all of you for joining us this morning for our March Wake Up with Research. We want to thank our wonderful researchers, Ellie, Guy, Shelley, Sarah, and Angela. Thank you so much for joining us this morning. We really appreciate your time and your insight and sharing all the work going on across our entire WSU system as it relates to health. This is our last Wake Up with Research until the fall. And so our plan is to take the summer off, and we will be back with a new host of research topics for you in September. We've got some great ideas already in the works. And for the researchers out there listening, get ready for an email from me asking you to participate here, because everyone's doing so much great work. As you can see from the slide there, we are planning on 2 in-person events so we can see one another in person, but we also do appreciate our statewide approach here and our reach, and so we're going to keep 2 virtual too, so folks can attend from across the state of Washington. We're really looking forward to our upcoming Wake Up with Research coming events here. If you want to follow up with anything that was shared today, please feel free to reach out to me and we'll get you connected to the faculty member that's there to best answer your question. I want to give another shout out and thank you to our sponsor, MultiCare, this morning. We truly appreciate your support and all that you do for our community here. Again, thank you to all our panelists and to our guests. We hope you have a wonderful rest of the spring, finishing out the academic semester here, a summer. We look forward to seeing you all in person in the fall for our next event. So with that, have a wonderful day, stay healthy and safe, and go Cougs.